Hi, my name is Gina Marchetti. Like Joel said, I currently am the supervisor of the Certified Recovery Specialist Warm Handoff program at Crozer. As Laura said, I'm also the Certified Recovery Specialist for Drug Treatment Court. I also happen to be a graduate of Drug Treatment Court. So questions, anything like that, please feel free. I'm very open. So the warm handoff, let me see if I can, there we go. Okay, so just an overview. The point of this presentation to define and discuss the warm handoff process, discuss certified recovery specialists in regards to the warm handoff process, the referral process and community engagement, as well as interfacing with law enforcement and other first responders. So what is a warm handoff? A warm handoff is a transfer of care that is conducted in person between two team members of a healthcare team or facility, connecting the client through the continuum of care. So in regards to what our CRS program looks like, we are able to go into any of the 7 surrounding Delaware County hospitals. It includes all 4 Crozers, as well as Mercy Fitz, Riddle, and Bryn Mawr. So our certified recovery specialists can go in to any of the hospitals as long as we get the call, 24/7, 365 days a year, holidays. We have someone on all day, all night, whether it's just for resources, whether it's if someone is seeking treatment and needs transportation, we can set that up. As was just said, juveniles, we can set up transportation, talk to family members, give resources, anything really that we need. Since January 2016, the Department of Drug and Alcohol Programs has worked with stakeholders to ensure a seamless transition for opioid overdose survivors from the emergency medical care to substance use disorder treatment. The transfer and handoff of care allows for clear communication regarding treatment options, resources, and thus improving the prospects of recovery. Certified recovery specialist. So everyone keeps saying that word, and I'm sure not everyone in here has heard of that. A CRS is just a peer that has lived experience with substance use disorder and can offer support and understanding. CRS can utilize their personal recovery experiences to help others. We promote self-determination, personal responsibility, and empowerment to individuals with substance use disorder. A CRS with appropriate training and certification can be utilized to provide referrals from healthcare facilities, emergency departments to treatment, and to provide screening and referral to providers qualified to clinically assess and refer treatment. Our program meets individuals in the ER and on the units of the hospitals that come in for any and all drug or alcohol related instances. So when the program first started, it was really geared towards opioid overdoses, and I think that's one of our main concerns right now. But then we saw that there was a need to engage people with any substance use disorder. We're seeing a lot of alcohol related instances right now, and a spike also in amphetamine and methamphetamine instances. So for our emergency department, like I said, 24/7 coverage, all 7 area hospitals in Delaware County, a resourceful point of contact following medical stabilization, following an overdose, and substance use disorder related admissions, personalized recovery focused peer engagement. We focus on emergent care referrals and facilitating warm handoffs. So we have been really successful in the oversight of the Office of Behavioral Health. We work very closely. We're able to get county funding for someone who is uninsured or underinsured right in the ER for any kind of withdrawal, overdose survivor, any emergent care need. We've also been very successful in working with Magellan, who's the behavioral health carrier for Delaware County, in working with the doctors and nursing staff for the clinical information, getting authorizations right in the ER as well. All of our staff, we have one of our CRS staff here, who I think worked with the juvenile. All of our staff have built tremendous relationships with all of the inpatient facilities, outpatient facilities. We work very closely with Key Recovery and the Keystone Center, their inpatient unit, for mainly our overnight admissions. Our own unit for steps, so we can get someone, if they present to a Crozer hospital, right into our own unit for steps. It's a 52-bed inpatient unit that's based out of the main hospital. And the great thing about having that relationship is that first steps I don't want to say any, but they will take someone with a very high medical risk. Any medical needs, they can refer out for MRIs, or if the patient has to be on IV at a time, we've seen that more recently as well. They can take any of those admissions as well. So this is just the road to recovery. So this is the big plan. So if someone's administered naloxone after an overdose, they go for emergent care, and that's kind of where we step in as the warm handoff. We would do the screening. We would try to obtain insurance or funding for the uninsured, underinsured, or we can work with the insurance carrier. For anyone that has private insurance, we work very closely with Recovery Centers of America, Malvern, Meermont, to get people right in. We've been successful with people who just call for resources. We've had our CRS staff place them right over the phone. They're in treatment in the facility within an hour. So the warm handoff goes to drug treatment, whether that is inpatient. The CRS staff can make referrals for outpatient, any kind of MAT. So we can make doctor's appointments for Suboxone maintenance, methadone maintenance. We can give them resources for the Vivitrol shot. So it's not just an inpatient detox or inpatient rehabilitation. We can make referrals for outpatient MATs as well. So interfacing with law enforcement. We've had a few law enforcement officers call just for resources. So I had someone particularly reach out to me just in regards to resources, what they can do. They had just arrested a person who was going to be released, and they just needed to know what to do. So when I was in this role and working as a CRS, I was able to go pick that person up right from where they were, bring them to our access center. Our access center will do level of care assessments from 7 a.m. to 11 p.m., 5 days a week for right now. We're also able to advocate. So we have more recently worked with many of the doctors in the ERs for a patient who is coming in with any kind of opiate withdrawal. We're able to advocate for the patient, and there's programs being put into place where our CRS staff can say, this person is going through withdrawal, they can't complete the paperwork. The doctor is actually able to give them a dose of Suboxone just to get through the paperwork so that we can get them placed in the inpatient facility. So we're able to collaborate with police officers on resources. We can educate on the process of getting the assessment, the funding, the bed placement for any recently incarcerated individuals. Like I said, we're available 24/7 for transportation needs. So if someone's arrested at 2 o'clock in the morning, is interested in treatment, wants treatment, we will set up transportation, bring them in the next day. If they need medical clearance, we can meet them in the ER. Wherever they're at, we can meet them and work with them. So they're here to help. I know they were supposed to be here. We've met with them in talks with the Office of Behavioral Health. We would love to start a pilot program. We would love to get calls from ENTs who just administered Narcan or naloxone. We would love to get calls from police officers who just administered Narcan. You know, people that refuse to go to the hospital, we're missing them, and they don't know that this resource is out there. They don't know that people are there to help them 24/7. Transportation, that's a big issue. They don't know what they need to get county funding or the paperwork or process or anything like that. So really what we are is a resource. We can place them in the ERs, but we also have resources for families. So we carry Nar-Anon, Al-Anon, have conversations with the families about what we've been through personally when it's appropriate. Like I said about the advocate, I think that's really important. Just a little self-disclosure. So medical professionals aren't really up to date on what substance use disorder looks like. So it's different. So when I walk into the emergency room for someone who's just survived an overdose, I can say I've been in that bed, literally been in that bed, crying with my mom next to me, not knowing the resources, not knowing what to do, didn't know where to turn. I can help you. It's a lot different. I remember, I'm an overdose survivor myself, so I remember my last overdose, I had a nurse come in and she kicked my bed every 5 minutes to wake me up. So it's different when someone's there, someone's been through it, someone can advocate for you and help you right hoops to get into treatment anymore. It is made so simple right now. All the resources we have available, we have all of it, knowledge for everything. Please call anyone. I think that's it for me. Yeah.